Hello, I'm Dr. Collins, and in this clinical examination video, we're going to take a look at straight leg raise, also known as the Lasègue sign, and the Sciatic Stretch Test, both of which are very useful special tests when assessing back pain. The Sciatic Stretch Test is essentially the straight leg raise with an added maneuver at the end to further tension the sciatic nerve. A positive leg raise or sciatic stretch test suggests the presence of sciatica in addition to low back pain. Sciatica refers to the irritation or compression of the sciatic nerve, which is the largest and longest nerve in our body that runs from the low back all the way down to each leg. Its irritation or compression typically causes sharp, shooting, or burning pain radiating from the buttocks all the way down the leg, and often with associated numbness or tingling. Distinguishing simple low back pain from low back pain with sciatica is important for two main reasons. First, it alters our management. Radicular pain, the sciatic type of pain, may require neuropathic agents in addition to regular analgesia. And secondly, bilateral sciatica is one of the red flags of cauda equina syndrome, which is a surgical emergency. If you would like a refresher on all the red flag symptoms of cauda equina, do check out one of our other videos where we summarize all the cauda equina symptoms under a simple mnemonic. Before we demonstrate the technique, a quick note on clinical value. The straight leg raise and the sciatic stretch test is highly sensitive, reported as anywhere from 80% all the way up to 97% sensitivity in some studies, but not very specific, typically ranging between 10 to 40%. In practical terms, what this means is that a negative test makes a significant nerve root compression unlikely, but a positive test alone does not confirm this herniation. It must always be interpreted in the context of the history and neurological examination. Now let's demonstrate the technique. For the purposes of this video, we will demonstrate the test on one side only. However, in clinical practice, remember that you must always examine both sides and always begin with the asymptomatic side. Doing this provides a baseline for you for comparison and helps the patient to also understand what to expect before assessing the painful side, putting them at a bit more ease. Ask the patient to lie flat in a supine position. Let the patient know that you're shortly going to raise their leg and ask them to let you completely carry the weight of their leg. All they need to do is tell you when and where exactly they feel the discomfort as you're moving their leg, if at all. Keeping their knee fully extended, gently and slowly raise the leg by flexing at the hip. You're assessing for reproduction of their typical radicular pain, which remember is a sharp shooting pain that radiates down from the buttock all the way to the leg, past behind the knee. The pain usually starts at around 30 to 70 degrees of hip flexion. If this maneuver so far reproduces their radicular pain, this means that the straight leg raise test is positive, and you can stop here. There is no need to push further, and you got your answer that this patient likely has sciatica. Now, if the symptoms are mild with the straight leg raise or equivocal, you can then progress to the sciatic stretch component by adding an ankle dorsiflexion while maintaining the hip position. Worsening or generation of radicular type of pain with dorsiflexion of the foot supports nerve root irritation. Remember, a positive test requires reproduction of the patient's characteristic radicular pain. Posterior thigh tightness alone suggests hamstring tension rather than nerve root irritation. For radicular type of pain, the pain needs to be sharp shooting at the back, radiating all the way down to the leg, past the knee. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical videos on our channel. Good luck!